The physical activity while performing activities of daily living is enough. Physical activity while performing activities of daily living. The physical activity while performing activities of daily living, the kinetic exercise, isotonic, isometric, endurance exercise. Isotonic exercise such as walking are intended to increase the muscle tone, increase the endurance, increase the muscle size, deplete the muscle. Isotonic exercises such as walking are intended to increase the muscle tone, increase the endurance, increase muscle size, and deplete the muscle. I think increase muscle tone. The type of exercise in which muscle contraction occurs without moving the joint is called. The type of exercise है इसको करने के बाद जिसमें muscle contraction होगा होता है. Type of exercise in which muscle contraction occurs. The type of exercise है जिसमें कि जो muscle का जो contraction है होता है without moving the joint is called isometric. The exercise that involves muscle contraction with resistance is called the exercise that involves muscle contraction with resistance is called isometric, isokinetic, isotonic, aerobic. Isokinetic exercises are those which involve muscle contraction with the resistance. Nurse plans to teach a client. Nurse plans to teach a client about the importance of exercise. And there are visitors in the room. So when there is in the room, when the client just when clients pay medication are working, this before lunch is more so they can alert when the client is talking about current stressors in his or her life. I can see. And B, the client's pain medications are working. Performance of active range of motion exercises by patient admitted in the ward will result in if if the patient performs active range of motion, improvement muscle strength, yes. Nerve regeneration, production vein development, A. An example of aerobic exercise is running 100 meters at a fast pace, jogging slowly for 2 kilometers, lifting 50 kg weights 10 times, doing yoga, taking deep and slow to measure nostrils again. Nutrition. The term anorexia is known as loss of appetite. Feeling of fullness, discomfort, nausea, and anorexia is termed as satiated. No, dysphagia is inability to swallow. Dyspepsia is inhibition. Appetite is decreased by all of the following: hurry, worry, and fear, yes. Regularity in eating, no. Regular meals, yep. No, appetite is decreased by all. अच्छा किससे मतलब appetite decrease नहीं होता है. Resulting, regularity in eating, yes. B. Type of diet recommended for a patient having difficulty in chewing. The type of diet recommend करते हैं, ठीक है, for a patient having difficulty in chewing and swallowing due to dry mouth is जो टाइप ऑफ डाइट रिकमेंड करते हैं पेशेंट के लिए जिसको चूइंग में डिफ़िकल्टी होती है और स्वॉलिंग में, ठीक है, तो उसे क्या बिकॉज ऑफ वॉट रीज़न, ड्यू टू ड्राई माउथ, तो सॉफ्ट डाइट देते हैं उसे या लो फाइबर देते हैं, लिक्विड देते हैं, लो रेसिड्यू चूइंग swallowing is liquid diet, no, it is soft diet. A plant diet consists of high carbohydrate and high fat, plenty of protein, non-irritating foods, yes, both A and C. Nahi, it's wrong. It's only non-irritating food. Which of the following is the therapeutic diet preferred in case of diarrhea? Which of the following is the therapeutic diet? Which of the following is the therapeutic diet? इनमें से कौन सा therapeutic diet है preferred किया जाता है in case of diarrhea? Therapeutic diet preferred in case of diarrhea is the clear fluid diet, maybe, yeah, soft diet, blend diet, and full fluid diet in diarrhea. I don't think so. Full fluid, blend. The therapeutic diet prescribed for patients in the post-operative stage for 1 or 2 days is जो थेरेपेटिक डाइट है, ठीक है, जो कि प्रिस्क्राइब करते हैं पेशेंट्स के लिए पोस्ट ऑपरेटिव स्टेज फॉर 1 or 2 days is the prescribed जो थेरेपेटिक डाइट है जो कि प्रिस्क्राइब करते हैं पेशेंट के लिए, जो कि इन द पोस्ट ऑपरेटिव स्टेज में, जो कि पोस्ट ऑपरेटिव स्टेज में, ठीक है, फॉर 1 or 2 days इज क्लियर लिक्विड डाइट, ठीक है, फुल लिक्विड डाइट, सॉफ्ट डाइट, लाइट डाइट, अगेन क्लियर लिक्विड। पोस्ट ऑपरेटिव क्लाइंट हैज़ बीन प्लेस्ड, और एक जो पोस्ट ऑपरेटिव क्लाइंट है उसको प्लेस किया गया है ऑन क्लियर लिक्विड डाइट। उनको क्या दिया जा रहा है? क्लियर लिक्विड डाइट। द नर्स प्रोवाइड्स द क्लाइंट विथ विच ऑफ प्रोवाइडेड आर अलाउड टू बी कंज्यूम्ड ऑन दिस डाइट। मतलब जिस पेशेंट को लिक्विड डाइट पे रखा गया उसको क्या अलाउड है? तो वेजिटेबल जूसेस, शरबत, कस्टर्ड, वॉल्यूम, I think, D. What is it? Volume? शरबत क्या होता है? शरबत. Which food should the nurse? Which food should the nurse remove from the tray of a patient on a low residue diet? अगर कोई पेशेंट लो रेसिड्यू डाइट में है, ठीक है, तो उसके खाने में से क्या निकालना चाहिए? कॉटेज चीज़, मैश्ड पोटैटो, लो रेसिड्यू, चिकन ब्रेस्ट, ग्रीन बीन्स, ग्रीन बीन्स निकालना चाहिए। वाई? That's what it is. Tube feeding lavas and gavas. Ankit Kumar is asking, how are you? I'm good. Tube feeding is lavas and gavas. Insertion of a tube inside the stomach through the nose is called nasogastric intubation. Which of the following indicates accurate measurement of nasogastric tube to be inserted? Tip of the nose to the earlobe and down to the xiphoprocess. Tip of the nose to the earlobe and down to the xiphoprocess. Tip of the nose to earlobe and down to sternum, no. Mark the tube at 10 inches, no. Mark the tube at 32 inches, no. The landmark for measuring the length of the nasogastric tube is the landmark for measuring the length. जो लैंडमार्क है, ठीक है, मेजर करने के लिए जो लेंथ ऑफ nasogastric tube is nose to epigastrium, tragus to epigastrium, nose to tragus. अच्छा, nose to tragus to epigastrium, yeah. See. The nurse is about to insert Weil's tube for a patient. Before this act, she must be aware of the distance between incisor teeth and the gastroesophageal junction. Which of the following is correct distance? डिफरेंशिएटिंग डायरेक्टिव डालने से पहले नर्स को पता होना चाहिए कि जो डिस्टेंस है इंसिजर टिप से लेके गैस्ट्रोएसोफेजियल जंक्शन तक डिस्टेंस पता होना चाहिए। अच्छा, A patient is to have gastric lavage. पेशेंट को क्या होने वाला है? गैस्ट्रिक लवास होने वाला है। तो उसमें जो in which position should the nurse place the patient when the nasogastric tube is being inserted? I think high Fowler. Yes, patient should be in high Fowler, ठीक है, गैस्ट्रिक लवास देने से पहले। उसको nasogastric ट्यूब लगाना है तो A feeding tube placed directly into the stomach. एक जो feeding tube है वो place कहाँ पे हमने किया है, stomach में किया है, through the artificial opening on the abdominal wall is called the gastrostomy tube. Because it's in abdomen. All of the following statements related to gastrostomy are correct. ये सारे मतलब सही है, कौन सा बोला था ना? Parenteral nutrition can be given through gastrostomy. Gastro is enteral, na? Wait. Nutrients are sent into the GIT through a feeding tube. Yes. It is the creation of an. अच्छा gastrostomy के बारे में क्या सही है? ठीक है. क्या सही नहीं वो ढूंढना है ना. Parenteral nutrition can be given through. Okay. It is the creation of an artificial opening into the stomach. Yes. Enteral nutrition can be given through gastrostomy. Yes. A is wrong. Parenteral nutrition cannot be given through gastrostomy. What is the widely used method to confirm the position of nasogastric tube after insertion? By dipping tip of the tube into bowl of water, pushing some air and auscultating X-ray and another widely used method to confirm. See, है तो सभी. X-ray must be the accepted. So all of the following are methods to confirm placement of Ryle's tube in the stomach except इनमें से कौन सा नहीं है. Listening to sound with a stethoscope while pushing air into the stomach. It is aspiration of gastric tube. No. It is telling the child to swallow water, taking chest radiograph. It's correct ना. Except कौन सा नहीं है. Can be confirmed by isolation of gastric tube. I never seen such. I see. It was a doctor. To check placement of the nasogastric tube, the nurse can order a chest X-ray examination after injecting 5 cc of into the stomach. चेक करना है हमें प्लेसमेंट ऑफ नासोगैस्ट्रिक ट्यूब का. तो नर्स को क्या करना चाहिए, एक चेस्ट एक्सरे मंगाना चाहिए आफ्टर इंजेक्टिंग 5 cc ऑफ इनटू द स्टमक. आस्क द पेशेंट इफ द ट्यूब फील्स. पूछना है पेशेंट को. Ask the patient if tube feels as if it is in the stomach. Ask the patient to take free deep breaths while pinching the nose. Inject 5 cc of air into the nasogastric tube while listening with a stethoscope for air entering the stomach. Number the steps to irrigate a nasogastric tube are correct. Clamp and disconnect the NG tube. We have to irrigate, na? Clamp and disconnect the NG tube. Slowly aspirate the syringe and reconnect the NG tube to the suction. Insert tip of the syringe into NG tube and slowly inject 30 ml of saline. Perform hand hygiene and apply clean gloves. Okay, at first we will do hand hygiene and then apply the clean gloves. That is D. So we got the answer A. First we will perform hand hygiene and apply clean gloves. Then we will clamp and disconnect the NG tube. Then we will go for insert tip of the syringe into the NG tube and slowly inject 30 ml of saline. Then slowly aspirate the syringe and reconnect the NG tube to suction. Go through once. While giving NG tube feeding, which of the following nursing actions prevent complications? अगर आप NG tube दे रहे हो तो कौन सा जो एक्शन है वो कॉम्प्लिकेशन को प्रिवेंट कर सकता है? एडवांस ट्यूब to 2 centimeter, flush with 20 ml of air, provide high Fowler position, plug the air vent during feeding. I think C. NG tube फीड करते थे. पाइप वाला पोजीशन दे देना, ठीक है। It's okay. I will not care. In another life, I would be your girl. Be us against the world. In another. Prior to feeding an infant by gastrostomy tube, the nurse should aspirate the tube, slowly instill 5 ml of water, provide the baby with a pacifier, place the baby in semi-collar position. So, the tube feeding should be delayed if the amount of the gastric content exits. जो ट्यूब फीडिंग है, ठीक है, उसको डिले करना चाहिए। क्यों? जो ट्यूब फीडिंग है उसको क्यों डिले करना चाहिए? The tube feeding should be delayed if the amount of the gastric content exceeds 50 ml. Yes. Match the pair. Orogastric feeding components with description or purpose. Orogastric tube aspiration, verification and positioning. The process of confirming the tube placement in the stomach is verification. 3A. Then placing the patient in an appropriate position to facilitate orogastric tube insertion is the positioning. 4B. The tube used for administering nutrients directly into the stomach through the mouth. The tube used for administering nutrients directly into the stomach through the mouth is orogastric tube. Acha, yeah. 1 ka C. And withdrawing stomach content to check for proper placement and prevent complication is 2 ka D. Okay. Prior to administering orogastric tube feeding, orogastric tube to an infant, the nurse should perform all except aspirate करना चाहिए, measure करना चाहिए abdominal girth, place in this slowly instead 5 ml of water. पानी नहीं डालना चाहिए. Which nursing action is essential when providing continuous enteral feedings? कौन सा जो nursing action है वो essential है जब आप provide कर रहे हो continuous enteral feeding को? Warming the formula before administering it. Essential. नहीं. Position the patient on the left side. Elevate the head of the bed adding methylene blue to the feeding to detect aspiration. C is correct. What is meant by the term gavaz? Visual examination of the stomach, a surgical opening, no. Administering of liquid feeding into the stomach, irrigation of the stomach where the solution is D. Gavaz. An artificial method of giving fluids and nutrients. Artificial method of giving fluid and nutrition through the tube is called intestinal gavaz, gastric gavaz, lumbar gavaz. None of the fluid giving fluid and nutrition through the tube is called for real. For गवास feeding of the client है ना, गवास feeding of the client के लिए the following equipments are needed. रबर सिलिकॉन फीडिंग ट्यूब चाहिए. गवास फीडिंग कराना है इन्फेंट को तो फिर इक्विपमेंट्स क्या क्या नीडेड है. रबर सिलिकॉन फीडिंग ट्यूब, 10 to 14 French catheter, non-allergic tape to mark the distance on the tube, water soluble lubricant. CED is mandatory. Gastric lavage is a procedure done to wash or irrigate the stomach. The process in which a nasogastric tube is inserted, the process in which a nasogastric tube is inserted. ठीक था, nasogastric tube insert किया जाता है. The stomach is flushed and ingested substances are removed through the tube is called the process. जो process होता है जिससे कि जो NG tube है वो insert होता है, जो process है the process in which an NG tube is inserted, the process in which a NG tube is inserted है ना, the process in which a NG tube is inserted, the flush and ingested substance are removed through the tube is called lavage, gastric lavage. Gastric lavage should not be done in case of poisoning. Yes. Height of siphon during the gastric feeding is an unconscious child required intermittent nasogastric feeding. एक unconscious child को intermittent nasogastric feeding चाहिए. When should the nurse check placement of the tube? When should required intermittent nasogastric feeding? When should the nurse check placement of the tube? Once a day, at every shift change, before administering any feed, during the right shift. See. Tube feeding diets are administered to reduce the hazards of indigestion, flatulence, regurgitation, and distension. Like if you regurgitation also. The client in the intensive care department has a NG tube for continued feeding. Client जो ICU में उसको क्या लग रहा है, NG tube लग रहा है continue for feeding. The administer the nifedipine XL via the tube. Which procedure should the nurse follow? crush the medication and dissolve in the water. Administer the flush and no. Give medication, no. Do not. A. क्लाइंट कंप्लेन्स ऑफ डिफ़िकल्टी ऑफ स्वॉलिंग. जो क्लाइंट है, ठीक है, वो कंप्लेन करती है डिफ़िकल्टी ऑफ स्वॉलिंग, स्वॉलो नहीं हो पा रहा, ठीक है. व्हेन द नर्स ट्राई टू एडमिनिस्टर कैप्सूल मेडिकेशन. द क्लाइंट कंप्लेन्स ऑफ डिफ़िकल्टी ऑफ स्वॉलिंग व्हेन द नर्स ट्राई टू एडमिनिस्टर कैप्सूल मेडिकेशन. व्हिच ऑफ द फॉलोइंग measures the nurse should do? Dissolve the capsule in a glass of water, crash the capsule and place it under the tongue, check the availability of a liquid preparation, break the capsule and give the content with an apple sauce. So Rohit's abdomen feels distended and he complains of nausea. His NG tube appears to be in place. Here first section will be notified the patient and administer the patient. Irrigate tube with 10 ml of sterile normal saline. Inject 50 ml of air injectors. No. Which of the following are intestinal tubes except Miller Abbott tube, Cantor tube, Levine tube, Harris tube? The nurse assists a physician with the insertion of a Miller Abbott tube. After insertion of a tube, the nurse would assist the client to which of the following position: on the right side, on the left side, on the left lateral, sim or prone. Small intestine में है इसका मिरर ट्यूब. मिरर अबॉट ट्यूब तो कौन से पोर्शन में देगी? राइट साइड में, लेफ्ट साइड में, प्रोन, लेफ्ट लेटरल, सिम, राइट साइड में. The most common problem associated with tube feeding is, I think, vomiting, diarrhea. An exploratory laparotomy is performed on a client who with melena and gastric cancer is discovered. A partial gastrectomy is performed and a jejunostomy tube is surgically implanted. An NG tube to suction is in place. What should the nurse expect regarding the client's NG tube drainage during the first 24 hours after surgery? NG tube डाला गया है सक्शन करने के लिए, ठीक है. तो जो नर्स है, what should the nurse expect? What should the nurse expect regarding the client's NG tube drainage during the first 24 hours after surgery? Contains some blood and clots. Patient का क्या हुआ? Gastrectomy हुआ, ठीक है. Part of stools removed. तो NG tube डाला कहीं सक्शन में 24 घंटे के अंदर क्या होगा? ब्लड एंड क्लॉट मिलेगा, क्लीन एंड विजिबल रहेगा. वो contain large amount of frying blood similar to coffee ground in current consistency. Which of the following statement related to the bowel wash is not true? इसमें से जो कौन सा है ना? Which of the following statement related to bowel wash is not true? It is performed to decompress the lower intestine and deflate the abdomen by removing gas and stool using small amounts of 10% dextrose. It is used as a mode of temporary management in proven case of hospital disease until the not true. Deflate the abdomen. Used in management of constipation in children. It's used pre-operatively in patients undergoing the global stomatitis A. Elimination. Dark and tarry stool is termed as melena. Hematochezia is seen in all upper GI bleed, lower GI bleed, piles, anal fissure. किस में नहीं मिलता है हेमाटोचीजिया? आई थिंक अपर GI bleed में नहीं मिलता है. ठीक है. Melena suggests which of the following injury had injury to large bowel, miscarriage, injury to upper bowel. Ineffectual straining at stool is known as borborygamy, constipation, tenesmus, which of the following condition can cause steatorrhea? Pancreatic enzyme insufficiency, disease affecting small intestine, bile acid deficiency, insulin deficiency. 1 and 3. Diseases affecting the small intestine. Borborygamy refers to borborygmy. Vascular sounds in the abdomen क्या है भाई? Borborygmy refers to the vascular sounds in the abdomen. Peristalsis movement in the abdomen, hyperactive bowel, absence of bowel signs. One of the following factors does not promote elimination. High fiber it does, anxiety also, exercise as well, normal to take. The nurse understands that which of the following behaviors would be helpful to facilitate a patient to have bowel elimination. नर्स समझती है कि इनमें से जो कौन सा बिहेवियर है वो हेल्पफुल रहेगा पेशेंट को फैसिलिटेट करने के लिए ताकि वो बाउल एलिमिनेट करें. Eat more fruits that increase bulk, decrease fluid, avoid long-term use of eat more food that increase bulk. Which of the following is a habit and lifestyle related problem? Constipation. All the following are causes of constipation except कौन सा नहीं है? Inadequate fiber intake it is, laxative abuse it is, decreased GI mortality causes decreased yes, decreased fluid intake yes, laxative abuse नहीं है. A fiber diet suggests for a constipation patient is based on the fact that it increases intestinal motility, decreases intestinal motility, it works as digestive enzyme, none of this. A constipated client is advised to increase the intake of the Ruge protein, fat, sugar in the diet, stimulates the peristalsis. Which of the following occurrence does a nurse have? To observe for in vaginal nerve stimulation while removing the fecal infection. Sponsored to nurse have to observe for in vagal nerve stimulation while removing the fecal infection. थोड़ा सा tricky question. Balbasa maneuver can result in bradycardia. Which of the following activities will not stimulate Balbasa maneuver? The use of stool softness, enema, it does. Gagging while toothbrushing, it does. Lifting heavy objects, it does. Enema. All of the following are reasons for administering an enema except relieve constipation, it is weight loss, prevent escape of fecal material during surgical procedure, establish a bowel training program. D. What is the purpose of a retention enema? To reduce bowel action. 20. The bowel to relieve distension by caused by the flatulence. To soften the hardened feces and gently stimulate the peristalsis. A client is जो client है वो scheduled है for requirements prepare what instructions should the nurse provide. The client in preparation for this diagnostic process of the client is scheduled sigmoidoscopy के लिए है. ठीक है. What instructions should the nurse provide the client in preparation for having anemia at the morning of the test? C. Administer of anemia is contraindicated in bowel perforation, ulcerative colitis, bowel out. Glycerin anemia is an example of glycerin anemia is an example of astringent anemia, emollient anemia. C. B. Purgative. This type of anemia is administered in case of poisoning, anesthetic, stimulant, sedative, emollient. The enema given to relieve the gaseous distension is anthelmintic, cold, carminative, purgative. Enema is also called antispasmodic enema, oil, cool, antihelminthic, carminative. B. What is the size of rectal tube while administering enema to school children? I don't know. In an adult, enema tube should be inserted inside the rectum up to adult major enema है ठीक है वो कहाँ पे insert करना चाहिए in an adult enema tube should be inserted inside the rectum up to 1 to 2 inches 3 to 4 1 to 2 inches only. While administering an enema the maximum safe height at which the container fluid can be held is a cleaning enema is ordered for a 55-year-old client before intestinal surgery. The maximum amount given is कितना देना चाहिए 150 से 200 200 to 400 400 750 750 to 1000 डी अच्छा A patient complain abdominal cramp during enema administration. Nurse should do immediately stop the enema. Clamp the tube until pain subsides. Stop the rate. Urinary catheterization irrigation. A Foley's catheter operates by principle of osmosis gravity. A catheter that remains in place for many days or weeks and is held in position by water-filled balloon is called intermittent catheter. Indwelling catheter. C. Urinary catheter is Foley's catheter. Identify the given image. This is Foley's catheter. C. Identify the given image. Ding. Malcott Ryle's tube. Is it Ryle's tube? I don't think so. Before performing an abdominal surgery, which instrument is used to prevent irregularities in micturition? Drainage tube, Ryle's tube, Foley's catheter. Which of the following interventions the nurse would carry out before inserting the catheter? Clean the perineum from front to back. Check the catheter for potency. Explain to the client that she will feel slight and discomfort. Arrange the sterile items on the sterile field. Why not C? Which of the following is a critical step when inserting an internal into male client? Advise the catheter. Advance the catheter until the urine flows, then insert it for 2 inches more. Slowly inflate the balloon with still saline. Saline नहीं है. 40 bundle of care is used for patient with the Hollis catheter. So, nursing intervention designed to decrease the risk of infection in a patient. जो nursing intervention है जो कि डिज़ाइन किया गया है डिक्रीज करने के लिए रिस्क ऑफ इन्फेक्शन को एक पेशेंट में विद एन इनवेलिंग कैथेटर. Nursing intervention designed to decrease the risk of infection in a patient with an indwelling catheter include nursing action. Nursing जो intervention है जो कि डिज़ाइन किया गया है decrease the risk of infection in a patient with an indwelling catheter include cleanse area around meters, empty the catheter drainage well at least daily. Change catheter every 48 hours. No. Maintain cool. Which of the following is a primary nursing intervention necessary for all patients with the Hollis catheter in place? For all patients with a Hollis catheter in place. Maintain the drainage tubing and collection bag level with the patient's bladder. Yes. Irrigate the patient with 1% neosporin solution 3 times a day. No. Clamp the catheter for 1 hour every 4 hours to maintain the bladder's elasticity. Maintain the drainage tubing and collection bag below the bladder level. Below the bladder level. What nursing action must be taken to prevent hospital-acquired urinary tract infection among the patients who are on indwelling human catheter? Ensure an adequate intake of IV in order to ensure clean technique for catheterization. Position the drainage bag higher than the no. Maintain a closed urine drainage system. No. Which of the following is the most common complication of urinary catheterization? इनमें से कौन सा बहुत ही कॉमन कॉम्प्लिकेशन है यूरिनरी कैथेटेराइजेशन का? urinary incontinence, UTI, urinary tract infection. Saline water is used to inflate the catheter balloon. जो saline water है वो इसको यूज़ किया गया है inflate the catheter balloon because saline crystal saline water is used to because saline to avoid pulling the urinary catheter, nurse should tape the catheter on the patient's catheter. Inflating the balloon prior to seeing the urine draining can result in inflate करना balloon को prior to seeing urine draining can result in urethral trauma. Yes. Trauma हो सकता है patient. During a retention catheter insertion or bladder irrigation, the nurse must use sterile equipment and wear sterile gloves. Clean equipment. Which of the following is not a common solution for bladder irrigation? KMNO4, sodium nitrite, boric acid, lactic acid. Which of the following solution is not indicated for bladder irrigation? Is not, right? Which of the following solution is not indicated for bladder irrigation? Sodium bicarbonate, potassium permanganate, sodium chloride, boric acid.